Dr. Mark Bittle, Director of the Population Health Management Program. Please share with us your background first.
Certainly, thank you. It's a pleasure to be here. I am the current director of the Population Health Management Program here at Johns Hopkins. Actually developed the curriculum 4 years ago, and am very happy to have been with it really since the inception. Prior to that, I worked in healthcare for 35 years in the areas of physician practice management, ambulatory care development, in both academic as well as community-based settings. So my experience really has encouraged me to develop this program as we think about transitioning from our typical acute care delivery model to one that's really focused on improving health in populations. I'm a fellow in the American College of Healthcare Executives. That's what the FACHE stands for. And I also did my doctorate in public health here in the School of Public Health at Johns Hopkins.
Thank you so much. Dr. Michael Ingui, could you please introduce yourself?
Absolutely. Thank you, everybody, and welcome. Appreciate you allowing me the time today to give a little bit of background on the program and to allow me to share some of my experiences. So my name is Mike Ingui. I'm a 2019 graduate of the Masters of Applied Science and Population Health Management program here at Hopkins. I started my career in healthcare actually working as a national account consultant for Blue Cross and Blue Shield of New Jersey, working on benefit redesign models and employing different wellness strategies to help large corporations reduce their healthcare expenditures and to help promote health and wellness to help keep their employees healthy. Wanting to kind of further my education, I really, fell in love more with the clinical care aspect of it, and I actually did my undergrad in kinesiology and biomechanics. So I did end up going for my doctor of chiropractic at the University of Bridgeport in 2014. I graduated, and I've currently been in private practice since. I am a fellow of the International Academy of Neuromusculoskeletal Medicine. That's the FIANM. Letters after my name, and I'll definitely love to share a little bit more about my experiences a little later on in the presentation.
For your introduction. To give everyone an idea of what we'll be covering today, Dr. Bittle will take us over the industry overview. He'll also go over the program details and curriculum for both the Masters of Applied Science and our Graduate Certificate in Population Health Management, looking specifically into the curriculum about what you'll be gaining out of the program and the specific courses. These programs are fully online, so he'll give you an insight as to what it looks like to be in online learning here at Johns Hopkins University. Faculty will be highlighted, and we are pleased to have an alumni with us today. I will go into admissions requirements, tuition, and financial aid, details about the scholarship we offer. At the end, we will have a Q&A, so please feel free as you're listening to the presentation. If you have any questions, type them into the chat box, and we will cover those at the end. Thank you so much for your time, and Dr. Bittle, please feel free to start.
Great. Well, thank you. So as I mentioned, I came to this position about 4 years ago in the School of Public Health, and having just left the healthcare field after 35 years. And one of the things that became very apparent to me in my latter years in the healthcare field was that we were certainly beginning to recognize, even more so than ever, how siloed or fragmented our healthcare delivery system is in the US, and that it was really built around this hospital-centric chassis or foundation, which creates a very expensive way of caring for individuals. With the passage of the Affordable Care Act in 2010, we began to realize and be held accountable really for the management of healthcare resources in this country. And a number of financial, political, and social changes were occurring, developing from that Affordable Care Act. One of the key elements that we saw happening was this shift from volume-based to value-based reimbursement models. And certainly for health systems, the incentives were really about improving how we integrate care and how we care for people across the continuum within our health systems. These we felt were essential to being successful in a value-based reimbursement model. However, we also began to realize that there are many other factors that influence health, and in fact 80% of our health is built around factors outside of the influence or the ability of health systems to be able to influence. So this idea of thinking about the social determinants of health, as they're called, and how they influence health, caused us to think about how do we now reach out and collaborate across sectors, thinking beyond the four walls of our traditional hospital and health system in order to ultimately improve health. And so that was really the concept behind our population health management program. You can go on to the next slide, thank you. It's really the basis for our population health management program. It's really thinking about how we integrate both the principles of public health and the tools that we understand today from a value-based care perspective. So we see this as an important strategy for providers and payers, consultants, anyone who's really in the field of healthcare delivery, as well as, I think, bringing the public health side to the table as well. I think it's important for them to understand how hospitals and health systems work. So we've developed this population health management program here at Hopkins to be very interdisciplinary. You'll see in a little while when I share with you who the faculty are, you'll see all the different departments that are represented. So this is just not a single department that's coming together to provide this curriculum, but it's really a interdisciplinary program that includes both working professionals, people who are in the business today, who are part of our faculty, as well as researchers in the areas of public health, population health, and healthcare transformation. So the curriculum is, as I say, very interdisciplinary. We'll go through that in just a moment. We do focus on these concepts of social determinants of health. We look at how medical care is being delivered and how it needs to transform to be more effective from a healthcare delivery perspective and a public health perspective. We think about, behaviors, lifestyle, and a broad range of different factors that influence our ability to improve health in our communities. So as you can see by the graphics here at the bottom, if you can bring those up. There we go. Perfect. So on the left is really the core functions of public health: assessment, assurance, and policy development. And on the right, may be familiar, it's the triple aim, which came out around the same time, a little bit before the Affordable Care Act in 2010. And the goals there is to improve health, lower costs, and increase the quality and experience of our care delivery system. The population health management program is really meant to be a bridge between our medical care delivery system and our public health core concepts, and really bringing those two together to create a model that's really focused on improving health in our communities. Next slide. So our curriculum is broken up into two parts. The first year is what you're looking at here. If you complete the first year's curriculum, you can earn a certificate in population health management. When you apply to the program, you can either apply directly to the certificate, or you can apply to the master's degree program. If you apply to just the certificate, these are the courses that you would take in your first year. Again, foundational courses that we think are important to giving individuals a good set of tools from a public health perspective, but also how those tools apply from a population health management strategy development perspective. And at the end of those 4 terms, so these are 8-week terms, so that this would conclude your first year, 25 credits, you would earn the certificate. Next slide. If you apply to the master's degree program, of course, you would complete the first year as we just saw, same classes. And then the year 2 curriculum, you'll see, really provides an applied set of courses to further develop your understanding of population health and population health management. What's important to note about each of these, and I think it's also implicit in our Master of Applied Science, is this notion of applied. So these courses are very applicable courses. These are courses that you will be able to take tonight's lecture and be able to apply it to tomorrow's work. We've tried to build the entire program around that and have continued to evolve it over the last several years so that it is truly an applied program and provides very practical learning, very practical tools to help you in your day-to-day jobs. So if you are in the master's degree program, at the end of the first year, you automatically will earn and receive the certificate. And then upon conclusion of the year 2 curriculum is when you would attend graduation to receive your master's degree. I will note that the very top part where it says year 1 or year 2, and it has some half credit requirements, essentials of One Health, globalization of health, those are likely not to be in the future iterations of our curriculum after this year. So I'm just pointing that out. But the year 1 and year 2 curriculum are as they stand today and are current. Next slide. So some of the program details, again, I've mentioned about the graduate certificate in population health management, 25 credits, 1 academic year for us, that's 4 terms, and you can earn a very nice certificate in population health management. You'll automatically get that if you go on to complete the Master of Applied Science in Population Health Management. Again, we've built this to be very practical in terms of our courses. We make it very much built around the fact that our students are working professionals. So it's a very skills-based type of program. We recognize that you're working full-time, so we want to make sure that we're giving you the most value for your time in terms of your learning. Because this is an online program, it's 100% online, and it's part-time. So what that means is, for the certificate, the first year, you could take up to 2 years to complete that. You could take 1 course per term, or you could take 2 classes per term. If you take the 2 per term, you'll finish in a year. If you take 1 per term, you'll finish in 2 years. Add another 2 years for the master's degree in the same way. As a part-time student, you have up to 4 years to complete that. We have done a lot in terms of online pedagogy, how we designed our curriculum so that you gain a lot of exposure to the people that are in the program with you. So there are group assignments that are virtual in nature. There are opportunities for peer collaboration. We think that you all, as students, again, working professionals, have as much to learn from each other as you do from us. So we really do try and leverage the skills and experiences of our students to help embellish and grow our program from a knowledge perspective and a skills perspective. I think that's one of the greatest parts about our program are the students that are in it and what they bring to each other and to the program overall. So again, hands-on, skills-oriented in terms of being able to apply this is really important to us. And so that's the primary focus of this program is to provide you not only the knowledge that you need, but also the ability to apply this in real life. Next slide. So you're going to hear from one of our alum, Mike, who not only is a 2019 grad, but he's our 2019 was our first graduating class, so he's among our inaugural graduating class. But he can give you a better sense of some of how this applies to his particular set of careers. But really, the program is designed towards people who are working in health systems today, or in payer organizations or consulting organizations. Pharmaceutical companies, many pharmaceutical companies today have population health management departments. So again, it's a pretty broad sector. As a program, we apply to a broad swath of sectors, not just hospitals and health systems. But these are typically managers and above that are taking our program, particularly people that are already in population health management roles. And I have some of the job titles listed there at the bottom, whether you're a vice president, director, or population health manager. But a lot of people are in these positions because they're working for these organizations that are developing these roles, and our degree program really provides them the underlying knowledge and information they need to be successful in those roles. So we see this idea of population health management as really being a bedrock to how healthcare is going to be delivered in the future, and provide essential tools for you to be able to do that successfully. Next slide. So as a school, I just want to share that we have we are the #1 school of public health in the country. We have a lot of experience in online learning. This is but one of many programs that are available online. So a lot of experience. We have a Center for Teaching and Learning that works with all of our faculty to make sure that our online content and delivery is done well. And again, hopefully, I appreciate Mike's feedback on that as well. We've developed these courses to be not perhaps what you're used to from an online perspective. If anybody has been involved in online classes, these are not simply you listen to a recording, you take a test at the end, and you move on to the next section. These are actually weekly modules. So it's almost like being in class, but you can pace yourself. So each week we release a new module. You will listen to some recordings. You may have recordings of guest speakers, a lot of different formats that we use to try and keep our lectures engaging, assignments that are due that week. We periodically will have in each course anywhere between 2 and 3 synchronous sessions, like today, where we get online together and talk, and oftentimes that's where we bring in live guest speakers. I just participated in one Tuesday night. We had 3 panelists that were talking about leadership in a population health management setting. And so these individuals were sharing their expertise with our students and allowed for, real-time Q&A. So again, as much as this is an online program, we do a lot through, these synchronous sessions, which are supported from Zoom, using Zoom, to allow our students to really get engaged and share across the cohort. The lectures are ultimately, everything is recorded, of course, even the synchronous sessions, and available on our course learning management system, which is Course Plus. And our students have, 24-hour, 7-day-a-week access for help. So if there are any technical issues, we have folks that are standing by to help work that out. Everything that you need is in our learning management system, whether it's the readings, whether it's the lectures, or any assignments and tests or things like that are all built in and teed up for you in a way, again, to maximize your utility as well as recognize the value of your time. Next slide. So I think this is probably one of my favorite slides of the presentation. This is just to give you a sense of the individuals that are teaching in our program. Many of them have been involved since the very beginning. But again, as you'll note at the bottom in the legend, you can see the various departments that are being represented here. So not only my department, Health Policy and Management, but we have International Health, Health Behavior and Society, individuals from the School of Medicine, Environmental Health and Engineering, as well as Biostats and Epi. We have, for example, Douglas Huff there at the bottom left. He's a behavioral economist and teaches a class in behavioral economics as it relates to influencing behaviors as we think about using incentives, particularly payment incentives, to influence not only provider behavior, but also how can we influence individual behavior. So again, we're very happy to have such a diverse group of individuals. Virtually everyone down the first on the left-hand side, with the exception of William Brager and Andrea Galen, everyone there is working professionals who are teaching part-time. On the right-hand side, again, the vast majority of those individuals are working in the field and teaching as part of our program. So bringing very practical experience as well as the research and content experience is important. Next slide. So I'm going to turn things over to Mike. It's really a pleasure to have him joining us. I am so appreciative of his time today, but we thought it would be great for you to be able to hear from someone who's been through the program, and again, as part of our first graduating class, it's really happy to talk to him again.
Great, thanks so much, Mark, and thanks again, and hello again, everybody. So my name is Mike Ingui, and currently I just wanted to share a little bit about my background and then go into a little bit as to why I decided to enter into population health management, why I chose Johns Hopkins, and most importantly, the value that I gained from this program and what it really did for my career. So currently I am the CEO and founder of CareLink Health Services Group, and we are a chiropractic medicine specialty group that contracts directly with federally qualified health centers, addiction medicine facilities, and large group practices to implement non-drug pain management programs to basically help work with chronic pain patients and substance abuse patients to help them get off opioids and other medication for pain. I'm also an adjunct assistant professor of clinical sciences at the University of Bridgeport, currently teaching courses in a variety of chiropractic diagnosis, orthopedic medicine, as well as healthcare business and leadership. Like I said before, I did start my career as a consultant when I was 21 years old. So definitely didn't know too much about the field, many years ago. And now going through the program, I have such a whole new appreciation for both the insurance industry and the care delivery system, and then obviously the clinical care system. So I'll kind of go into a little bit about that shortly as to how this program helped me merge all of my experiences together. And like I said before, really just changed my career for the better. So like I've been a practicing chiropractor for 5 years. And a couple of years ago, I had a great opportunity to work on a grant project called the New Jersey Pain Care Collaborative. And that was a program through the Nicholson Foundation, which is a very large nonprofit in New Jersey, to try to help promote health equity and to also provide clinical and healthcare services primarily to the underserved population. And in New Jersey, if anyone is from New Jersey, one of the things that we have, as well as across the country, is a very big problem with opioid addiction and substance use disorders. Unfortunately, no community health center, and for those that don't know, community health centers are safety net healthcare facilities where underserved patients, uninsured patients can go and receive quality healthcare services. Well, unfortunately, a lot of these patients are presenting to these facilities with pain conditions, whether it's back pain, neck pain, or headaches. And there really wasn't an alternative to opioids for these patients. So we were seeing a high percentage of pharmaceuticals being dispensed for pain management. Really, there were no programs in place to help empower patients to control their pain, whether it's through physical therapy or chiropractic or other non-pain programs. So the whole purpose of the New Jersey Pain Care Collaborative was to implement an alternative to opioid program. And one of those legs was to do a pilot chiropractic / physical therapy program at one of the community health center sites in Monmouth County, New Jersey. And I was fortunate to be appointed as that chiropractor, where we actually worked with our state legislatures to get the appropriate paperwork, because prior to this, these community health centers could not turn a profit on any services that a chiropractor or physical therapist provided within their facility. So we did, through the help of the Nicholson Foundation, we were able to get the appropriate paperwork together, and I developed a care program, and we were successful and to deliver reimbursable chiropractic services within the federally qualified health center. And I'm proud to say that that program has started to expand. And it was really at this moment, this was probably going on about 3.5 years ago, where I quickly realized that there is a lot more than just implementing a chiropractor to help these patients. I started really thinking and start asking myself, there's definitely a lot more that needs to be done, because as Mark refers to the four walls of the healthcare facility, I definitely saw that firsthand. And our chief medical officer was the one who actually introduced me to population health. And I started to do a lot more research about it, and kind of going on my own experiences as a clinician working in this particular setting, I said to myself, oh, this is absolutely something that I need to know. This is something that I can really, learn, and I can really take these tools to really make a more robust, comprehensive program to really have a more meaningful impact on these patients. So as you can see here, what I wrote on the last part here, the program at Hopkins really did provide me with these critical skills. Most importantly, a lot of these patients are very attached to their communities. So certainly evaluating and doing a community and learning how to read a community health needs assessment really kind of helped me understand more what the community problems were and how that was directly affecting to their health status. And that's something that as a whole, the community health center that I was working in definitely started to get a lot better with. And we really started to see a shift in our outcomes, where patients were starting to, at least for our purpose, we were starting to see a shift in opioid prescriptions being dispensed. We were starting to see patients' functional status return at a much quicker rate. And more importantly, we were just starting to see a lot more happy patients. So it was definitely something that was really cool. All right, next slide, please. So why did I end up choosing Johns Hopkins? Well, as you heard Mark referred, yeah, the Bloomberg School of Public Health has consistently been ranked as the #1 school of public health in the country. And that was something that obviously was really cool. But I think that in 2019, they celebrated their 100th year anniversary. And to me, I think that's such a really, really awesome thing because Johns Hopkins School of Public Health has been proven. It's been around a long time. They are a leader in research. And for me, as a clinician that wanted to learn as much as I can to really help people, I want to go to an institution that has the best of the best. I wanted an institution that has been around. They have tested their theories, they have proven their theories, and they are a world-class leader in research. And that to me was so important in my decision for choosing Johns Hopkins. The curriculum did focus on core public health and population health concepts that really are needed for today's healthcare leader. While I was figuring out, I knew I wanted to advance my career, not just as a clinician. So I was figuring, do I want to go for an MBA with a healthcare focused or a traditional master's of public health? And then my chief medical officer told me to look into population health management. So kind of evaluating the population health management curriculum at Hopkins, I said to myself, wow, this is great. Everything that I would want in a traditional MBA program and everything that I would kind of want in a master's of public health program, and then this whole notion of population health, it was kind of all packaged into one degree. Certainly MBAs are fantastic degrees. I'm not an accountant. I am, not a finance guy, but there were certainly some aspects of it that I definitely wanted to learn. Same thing with public health. So I really felt that this degree fit my needs the best, and it really blended everything together. I think one of the most important parts of any academic program are the faculty and leaders that are leading that program. And I can honestly say that all faculty are experts in their field. When you are reading their research and you're reading articles that they published, that to me tells me that these are individuals that have dedicated their lives to the advancement of healthcare. The fact that they are being continually published is such an incredible thing. So they really are experts in their field. And because they're experts in their field and they've done a lot of work in both practicum and academia, they've developed an expansive network of other healthcare leaders and specialists. And like Mark said, there are many, many times where they will bring these experts on and introduce us to these experts and allow this collaboration. And oftentimes there's opportunity for ongoing collaboration even after graduation. So you really are able to, build a much bigger network from our faculty. As you heard, the online program did allow me to continue working in my clinical care role full time. And one of the things Mark said early on in the presentation, I was smiling because he is 100% right. And I'll tell you, I'll share a story in a second because, really concepts that I did learn on a live talk or just listening to a lecture at night, I would actually be able to implement either the next day or later that week. So once I really started learning about social determinants of health and we were realizing how critical these were, I went to our chief medical officer at the FQHC I was currently working with and said, hey, we're not screening for these. Is there a standardized procedure that we're screening for these? And we ended up starting to use the current tool that's provided by the Center for Medicare and Medicaid Services. And now, as part of the general intake process, they are now screening for social determinants of health in a more systematic fashion. So that was kind of one thing that, I really, once we learned the importance of it and how critical it is and how crucial it is to be screening for these, we were able to implement that literally the next day in practice. So it is relevant knowledge, and it's unfortunately there's a lot of programs in academia that have a lot of fluff, and I can truly say that this program, there was no fluff. All the content I learned was extremely relevant. I think it's extremely necessary to really advance healthcare and to start lowering costs, improving health outcomes, and truly better aligning ourselves with the triple aim. This program, I can't say enough great things about it. It was truly very well organized. I'm actually an online instructor myself now at the University of Bridgeport. I was teaching in person, and a lot of the techniques that Hopkins did, I actually kind of, now implemented in my own online learning, because I have taken a bunch of online learning programs before, but this is by far the most well organized, provided the most relevant evidence-based coursework material that I've ever seen. And really, one of the great things is it is led by faculty who challenges us to become better thinkers with each and every week. These 8-week terms really did allow me to work through the material at a nice pace. It was challenging, but it was a good, comfortable pace. I was never bored. I was always intellectually stimulated, and oftentimes after lecture, it always wanted me to say, you know what? I want to read more about this. I want to learn more about this. It opened my eyes, and it really gave me this whole new skill set that I never would have had before. Next slide, please. So I think the most important thing is, what was the value that I gained from Johns Hopkins School of Public Health and the Population Health Management program? Well, again, the content I was able to implement into practice after each and every lecture. And I think, when someone can say they can do that, it's such a wonderful, wonderful thing, because at the end of the day, most of us are practicing professionals, and we're in healthcare because we do want to make a difference. And unfortunately, one of the things that I learned is our system is very siloed. It is very broken. But now, having these evidence-based tools, having these concepts where instead of being on the side that basically just points out the problems, I was now able to bring forth a solution. Even if it was a small solution to begin with, it was still a solution. We weren't being the status quo. We were challenging the status quo, and we were really, 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 implementing these solutions to actually now start driving the needle into improving healthcare. Definitely learned how critical social determinants of health were in health outcomes. I'll be honest, prior to entering the population health management program, I've never even heard of social determinants of health. And after doing a lot more research on it, I cannot believe I ever went through 4 years of a professional program and never once heard the term social determinants of health. But I can tell you right now, learning this really helped us develop much more robust care plans to address these factors. And we have, caught a lot of issues, and we were able to connect patients with community resources and other services necessary. And, really that helped make a big difference in their outcomes. I definitely learned how to become a better leader through evidence-based strategies. Dr. Bittle teaches an excellent course on leadership. He made us at one point do a leadership development plan that I still update every now and then. And it's a really great way to thoroughly evaluate your leadership skills, learn what type of leader you are, but most importantly, where are there opportunities for improvement, how I can improve on leading my teams to make for a much more overall better experience for my teams, which will lead to better care that we provide the patients and the clients that we serve. I'll tell you, I definitely became a much better writer. I certainly was able to write, but really this program definitely challenged me to become a much better writer, both from a content standpoint, both from a researcher standpoint, and also from a grammatical and spelling standpoint. So I definitely am much more careful with my grammar and spelling than I've ever been before. But I will say a lot of what we do is generating relevant content, both for our company and communities that we serve. We need to engage providers and patients in our company to help them buy into the programs that we're developing. So definitely content is so critical with what we're doing each and every day. I loved the opportunity to connect and collaborate with other students, and we were fortunate to have students not only from all over the country, but also from a handful of other countries. And a lot of them came from diverse backgrounds. Some of them were clinicians, some of them worked in pharmaceuticals, some of them worked in sales. So it was really great learning about different industries in healthcare. And like Dr. Bittle said, there were many instances where we would get on a live talk working with our classmates on a different project. We would exchange cell phone numbers, and I still talk to some of my colleagues even today. It's really just a cool experience. So let me get to actually I'll provide a couple of examples on how the skills that I learned from the population health management program, how I turned that into practice. It did help me become a better leader in my profession and it actually helped launch my new company. CareLink actually was birthed as a result of the final project that we did for our masters. And one of the things that you'll learn through this program is something called the collective impact model. And right now we're in our final stages of developing our NOPE program initiative, and this is the non-opioid pain effort. This is going to be a community-based program in northern New Jersey, and the whole purpose of this program is designed to help promote alternative pain management programming and opioid awareness. So, really collective impact model is going to play a critical role as we engage multiple community resources and different community leaders to, help basically move the needle, because unfortunately in the particular county that we're located in, we're still seeing rates at an all-time high. And unfortunately, there are many hospitals and healthcare facilities that are still dispensing, opioids, and we're still seeing, unfortunately, a very high rate of substance use disorders. Learning about alternative payment models and value-based payment methodology really helps, because now I'm able to go to larger healthcare organizations and actually consult with them and basically educate them on different HEDIS measures and how our programming can help them achieve those HEDIS measures, how their programming can help them successfully participate in some of these alternative payment models that are around. And definitely having new knowledge on systems thinking, care, modeling, care coordination. These are all tools that, again, if it wasn't for Hopkins, my company definitely wouldn't exist, and we certainly wouldn't be, where we are today. So I'm really forever grateful for the program. So when I do say it was a career-changing experience, it really is true, because, I absolutely love what I do every day as a chiropractor. I love working with patients. I love basically guiding them through different exercise and home rehab programs to help them control their pain a little bit more naturally. But if someone looked at me and said 4 years ago, now you would be working with, large-scale physician practices, addiction medicine facilities, federally qualified health centers, I would say, it's crazy. It's never been done before. And, here I am, thankful for Hopkins for giving me these skills, because, now we can, like I said, instead of just complaining about what the problem is with healthcare, now I actually have evidence-based solutions that we can put forth, and we are seeing some really great successes. So I can't say enough great things. And like I said, it's just a wonderful experience that I hope everybody will definitely consider. And I will certainly answer any questions at the end of this program that anyone has.
Mike, I just want to jump in and first of all, thank you for such a wonderful commentary about the program and in particular the applied nature of it in your own career. That's just so reassuring for us to hear and for me to hear as program director. I did want to just point out for those listening, 3 things that came up, I think, multiple times in both things that I've said and Mike has said, and that's this notion of applied. We didn't really go through the curriculum course by course. We don't have the time for that. So I encourage you to go to our website and look at the courses that we're offering. So they are about quality, they are about payment models, collective impact, leadership. Again, it gives you a very broad and necessary overview of the critical elements of population health management. And again, this is all evidence-based, evidence-informed. So we built a program around this notion of trying to apply what works and providing you that evidence so that you're able to translate it into your own work. But I think the key for me, and Mike said it a couple of different ways, is this notion about impact or making a difference. We're looking to be able to provide you with a master's degree that's going to allow you to go out and make a difference, to truly go out and transform, as Mike just said, the way we're delivering care and really bringing a more targeted focus on improving health. So this notion of impact is really important to me as we thought about this program, because our goal is exactly what Mike said, is wanting all of you to be able to go out and make a difference. So with that, I'll turn it back over for our review of the admission requirements.
Thank you, Mark and Michael, for all the insight into our population health management programs. For those of you that joined us after the start of the presentation, please make sure to type in your questions in the chat box for our Q&A at the end. I'm going to take some time to go through the admissions requirements, and if you're interested in moving forward, it's important to know what you need to know for the admissions process. Our master's applications are all processed online through Sophus, and our certificate application is processed through Sophus Express to streamline your application process. The requirements for education is a bachelor's degree from a regionally accredited college or university. The professional requirement is a minimum of 3 years of work experience in the health-related field. We do require a current resume or CV to be uploaded into the online portal, highlighting previous healthcare accomplishments. You will need 3 letters of recommendation for the master's application and 1 letter of recommendation for the graduate certificate application. The statement of purpose is the biggest part of your application process. This is where you'll be able to communicate to the admissions committee why this program, how this program matches up to your career goals with educational objectives you are trying to fulfill, and how you hope to apply it to your career and in your future. For our international students, if English is not your first language, you may need an English proficiency exam. We accept either the TOEFL or the IELTS. For those who have obtained education outside of the U.S. for your academic records, it is a requirement that you undergo a course-by-course evaluation via the World Education Services. As you can see, we've shortened it out for WES, which stands for World Education Services. I do encourage you to review the WES requirements. That way, you can see what they require from your university and how your university should send those records to them directly. We are very used to working with students on this for the admission in the Office of Admissions. If this is something that you need or have questions about, please feel free to reach out to us so that we can get you connected to the right resources and websites to get you started on that process. There is also no GRE or GMAT required for the application, if that is something that you had a question on. Looking over the admissions information, our applications are reviewed on a rolling basis. We do encourage you to apply early to receive your decision early. You do not need to wait until the deadline is posted on this slide to hear back from the committee with your decision. Applications are now open, Sophus for your master's application with a priority deadline of April 15th and a final deadline of June 1st. Our certificate application is also open in the Sophus Express portal. The final deadline is July 1st. Our fall start is June 1st. July 1st. Our fall start this year is August 31st. We encourage students to apply early, and we are here to assist you through the application. So if you have any questions or concerns on the application, you do have a support system with us. It is important to know if you're excited about this program, we only enroll once in the fall of each year. So if you're interested in starting in the fall but not sure you want to commit to a full course load, you do have the flexibility of starting 1 class at a time. To provide insight on the investment of school, right here is listed our financial aid information with our financial information as well. For those who are eligible to utilize other financial resources such as FAFSA or private loan information, feel free to look at our website or email or call them. The information is listed on this slide here. For the 2019-2020 school year, the tuition is $1,162 per credit. We offer an OPAL scholarship that is available for these programs, which is a partial scholarship that covers $446 per credit, which leaves students responsible for the remaining $716 per credit. This scholarship is specific funding for our OPAL programs, which is our online programs for applied learning. So if you're admitted into the program, you are automatically awarded that OPAL scholarship. There is nothing additional you need to do to receive it. If you are planning financially, you will be wanting to plan for that $716 per credit at the current tuition rate. Of course, keeping in mind our tuition rate and scholarships are reassessed each spring. Any changes will be updated on the website in late spring. Once again, our credits for the certificate is 25 credits. For the master's, it is 51 credits. Now we have time for our Q&A session. If you have, like I said, if you have any questions, feel free to drop them into the chat box so that we can get your questions answered. We do have some questions that have come in already. Could you please elaborate on the integrative activity at the end, term 4, year 2 for the master's?
Okay, this is Mark. I can start, and maybe Mike would like to add something to it from a workload perspective. But so the integrative activity for all master's degree programs, students are required, and this is pretty much for any school, required to do a capstone. We call our capstone an integrative activity, and it really is meant to do just that. You're asked to take to demonstrate your ability to integrate the materials, concepts, readings, everything that you've learned over the last 2 to 4 years, depending on how long it took you to finish the master's degree, into this capstone. The capstone currently is a standardized case that we use. It may change over time, but ultimately the goal is for you to be able to demonstrate that you've sort of mastered the material. So there is no sort of culminating exam for our program. It's really this finishing this capstone. The capstone currently, again, requires the preparation of a paper, an analysis of the case that's about 20 to 25 pages long.
Yeah, absolutely, Mark.
Thank
This
you.
is Mike. And I can add a little bit onto that in terms of what Mark was saying about workload from a workload perspective. Yeah, no, the experience, like I said, was wonderful, and it really forces us to use all these skills, basically what we're going to be doing in practice. And in terms of a workload experience, I mean, certainly it was involved, but with appropriate time management, I would work on each piece of the case. I had my outline set up, and basically, I'd say probably about 25 or so hours a week, over the course of the entire, term. And that was definitely something that, it was very manageable. I was able to do it, and certainly challenging, but extremely rewarding once you see that finished product, and you really kind of prove to yourself that what, I can do this, and this is what it's all about.
Awesome, thank you. This is a good question. If a student is deciding between an MPH, a Master's of Public Health, and the Master's of Population Health Management, what advice could you give them into which one to pursue? Maybe noting some key differences with those two degrees.
It's a great question. This is Mark again. I'll start, and then if Mike wants to add anything. I think that there is clearly an overlap between the MPH and the Masters in Population Health Management. Again, what we've tried to do is create, with the Masters in Population Health Management program, is to create a bridge between understanding sort of healthcare administration, as if you were going to get an MHA, a Master's in Health Administration, with the concepts and core principles of public health. It's really bringing the two together. I think as we think about where the industry is headed, I'm talking about sort of healthcare in the broader sense, it's really about how do we bring these two silos together. Historically, again, we've spent a lot of money on healthcare in this country, $3.6 trillion. We spend a very small percentage of that on public health activities in relation to particularly other developed countries. And then you can see some of the reasons for that, or some of the causes of us having worse health outcomes than other countries is because of the imbalance in how we spend money in this country. So we've tried to bring the best of both worlds together in the population health management. A strict MPH will give you the ability, I think, to learn those core principles around public health for sure. Again, that's where the overlap is. I think what you will not get necessarily, and this really depends on the programs that you're looking at, is that healthcare context, the actual healthcare management context. So again, we have a master's in health administration that we offer here in the School of Public Health. We've been able to take some of that content, some of our MPH content, and merge them together in this relevant population health management model. So again, I think it really does help bridge the gap between the two, whereas if you take an MHA or an MPH, you're going to get one or the other, but not necessarily both.
Okay, next question. Thank you. if someone has been a nurse for several years, and most applicants, since you said most applicants are already managers, should they wait to apply? Or what specific academic backgrounds are you looking for as the admissions committee?
Great question, and I didn't mean to imply you have to be in a manager role to apply for this program at all. What I said is a lot of the applicants that we have are in some form of a management role. That being said, we also, a good number of our students are nurses, many of whom are one of Mike's peers who graduated in the same year he did actually has a doctor of nursing practice already. So we have people with doctorates in various topics. We have physicians, chiropractors, pharmacists. But I think what we're really looking for in terms of an applicant is number one, do they have some are they in healthcare now in one of our sectors? Because we hope that our students have some understanding of how healthcare works in this country today. We provide, I think, a good looking at our first year curriculum and how that then builds with our second year curriculum. We provide you a lot of baseline information. So if you come in and you're sort of a novice to healthcare, I think you get a good sense early on about the key elements. But if you have 3-4 years of experience working in healthcare, nurses, we love having nurses in our program. We think nurses are going to be critical to population health management strategies, as with many others. Disciplines, but clearly having that clinical experience is exactly, I think, what's going to help make you successful. So part of it is just really having that sort of baseline understanding of healthcare, being in the industry, and then the other thing that we really look at, and it was mentioned earlier, is that statement of purpose. We on and I'm on the admissions committee, so we do look at that to say what is this person hoping to do when they finish, and so having some clarity around this is my goal, this is why I want to do this, is really important to be able to articulate that in a way that connects sort of your passion, again, as I mentioned earlier, based on Mike's comments, this idea of making a difference, creating an impact, is linking that passion to the reason for wanting to be here.
Great, thank you. Could you elaborate on the assignments week by week? Kind of like the time commitment is usually 18 to 20 hours a week for those 2 courses that you're taking. Could we just see what that looks like? You could discuss that.
Mike, you want to start with that one?
Yeah, absolutely, Mark. So the time commitment. So basically what I did was I essentially kind of made my schedule as if I was kind of going to class in real time. I would spread it out over the course of four nights a week, anywhere from 2 to 3 hours, and then generally a little bit on a Saturday and a bunch on Sunday. Like I said, it was definitely very, very manageable. I think 18 to 20 hours is definitely extremely realistic. It is very doable, but the one thing I definitely found helpful was spreading that over a couple of days, as opposed to kind of doing if I had a day off here and doing 9 hours straight there, and then on a Sunday doing 9 hours straight there, I would have just gotten burnt out. So definitely kind of taking those 18 to 20 hours a week and spreading it across throughout the entire week definitely was something that helped me. And really I never felt overwhelmed at one point. I always was able to handle all my caseload, work with my patients, and then jump on and do the required work, and obviously still have time to learn and process the material.
Yeah, and I'll just add to Mike's comments, which are spot on. I mean, when we developed this curriculum and this program, we developed it with working professionals in mind. So we did try our best to make sure that, for example, if you're taking 2 courses per term, which would be sort of the maximum you could do, we work together as faculty who are teaching those courses to make sure that my due dates and Mike's due dates are not going to overlap. Occasionally they do, just because of timing issues, but we work very hard to sort of make sure that we're not, creating undue burden on students by spreading things out throughout the 8 weeks. We have taken student feedback over the years to say, hey, I think there's a little bit too much reading in this course, for example, and we've looked at, try and adjust that to make it, a well-balanced process. All of our courses, each module, each weekly session is released on Monday morning, and it closes essentially on Sunday at 11:59 p.m. So you have the entire week to essentially work on the materials for that week, whether it's listening to the lectures, whether it's working on an assignment that might be due, or a discussion board post. And so again, it also allows you then to weekends to be able to do things. So I think the critical element, and I've heard this from a number of students now, is just really is creating a schedule. Like anything else, I mean, you're working full time, you have other things that you need to be able to do and want to do, both professionally and personally. So we strongly encourage good time management, but otherwise, we've taken into consideration you as a working professional, being part of this, and we're always looking at feedback as well. So every one of our courses is evaluated by the students. We read that evaluation. As program director, I read every evaluation for every course, mine included, and so we want to continually adjust and tweak it so that it's optimal for our students.
Okay, so this is our last question that we have time for. Networking opportunities. What kind of networking opportunities provide to students that are, join the program?
I'll jump in real quick. This is Mark, and I know Mike mentioned this earlier about creating contacts. So again, I think one of the things that we try and do is introduce our students to each other. We currently have 112 students in the program at some point in the process, again, because you could take it part-time or essentially this full-time, 2 courses a term. So we have group assignments, we have opportunities for students to interact on assignments. They get to know each other well throughout the program, and it becomes a lasting network of contacts that people have. With now an alumni group, Mike is part of our alumni group now, and that'll be growing. We have 42 people scheduled to graduate in this May. So as that alumni network continues to grow, we have a LinkedIn page for that. We're developing a Facebook page for that. But we're really looking to create connections amongst our student population. And I think the more students, again, the program is fairly early in its offering, but I think over time we're going to have a very strong network, and that's something that we want to continue to develop and reinforce.
Thank you all for your attendance. Thank you, Mark and Michael. If we didn't get to your questions, the admissions office will be in contact with you directly in the next few days to assist in answering your questions. If you want to connect with someone immediately, my contact information is on the slide here. Feel free to reach out via email or directly call me. If you're excited about this presentation and see this as part of your future, please feel free to use a scan code here to move forward with your applications. We have a dedicated admissions team who is looking forward to working with each and every one of you throughout the application process. Once again, thank you, Mark and Michael, and thank you all for joining us. We hope to talk to you soon.
Well, thank you. And Mike, thanks again. I really do appreciate your being here with us today.
Absolutely. Thank you, Mark, and thank you, everybody. It was a pleasure talking with you all.